Welcome to Med About You, your health solution. What is premature ejaculation? Premature ejaculation PE is a common sexual dysfunction in men where ejaculation happens sooner than desired, either before or shortly after penetration with minimal sexual stimulation. It can lead to distress, frustration, and may affect relationships. Types of premature ejaculation PE. There are two main types. 1. Lifelong, primary, PE present from the first sexual experience. 2. Acquired, secondary, PE develops later after previous normal sexual experiences. What's considered premature? A. Ejaculation within 1 minute of vaginal penetration for lifelong PE. B. A consistent lack of control over ejaculation. C. Associated with negative personal or interpersonal consequences. Note, it's not about the exact time but about lack of control and satisfaction. Causes of premature ejaculation. Let's dive deeper into the detailed causes of premature ejaculation, PE. They can be broadly categorized into psychological, biological, and other contributing factors. PE often results from a combination of these. 1. Psychological causes. These are very common, especially in younger men or those new to sexual activity. A. Performance anxiety. Fear of not satisfying a partner can lead to overexcitement, increasing arousal quickly and leading to early ejaculation. Common in new relationships or if there's a history of sexual mishaps. B. General anxiety and stress. Anxiety from daily life, work, or relationships can spill over into sexual performance. The body remains in a fight or flight state, causing faster arousal and quicker ejaculation. C. Early sexual conditioning. Men who grew up masturbating quickly, for example in fear of being caught, may have developed a habit of rushing to climax. This becomes a learned reflex that's hard to control later in life. D. Depression. Can reduce sexual confidence and arousal control. May also lead to less motivation or energy to engage in longer sexual activity. E. Relationship problems. Conflict, lack of trust, or emotional disconnect with a partner can cause tension. This tension can translate into poor sexual control and early ejaculation. 2. Biological causes. These are more common in lifelong PE and sometimes in acquired cases too. A. Neurotransmitter imbalance, serotonin deficiency. Low serotonin levels in the brain are strongly linked to PE. Serotonin helps delay ejaculation, too little of it speeds things up. This is why SSRIs, selective serotonin reuptake inhibitors, which increase serotonin, are often effective treatments. B. Penile hypersensitivity. Some men may have a highly sensitive glans tip of the penis, making it hard to last long during stimulation. May be anatomical or due to nerve-related issues. C. Hormonal issues. Low testosterone, thyroid dysfunction, especially hyperthyroidism, can affect ejaculatory control. These imbalances can increase arousal or reduce the ability to regulate it. D. Prostate or urethral infections. Infections like prostatitis can cause irritation, pain, and premature ejaculation. Often temporary and resolves with treatment of the infection. E. Genetic factors. Studies suggest that PE may run in families. Men with a genetic predisposition may have inherited traits related to ejaculation control. 3. Other contributing factors. A. Erectile dysfunction, ED. Men with ED may rush to climax before losing an erection. This urgency can train the body into a quick release habit. B. Alcohol and drug use. Alcohol in small amounts can reduce anxiety, but in larger amounts can interfere with performance. Recreational drugs, like cocaine, marijuana, can also cause erratic control. C. Medication side effects. Certain medications, like stimulants or thyroid meds, might increase arousal. Sudden withdrawal from SSRIs or antidepressants may trigger PE. Combination of causes. In many cases, it's not just one thing. For example, a man with a slightly sensitive penis may develop anxiety from poor early sexual experiences, and this compounds the problem, or a man with mild depression might also be taking meds that worsen arousal control. Treatment: premature ejaculation PE. The most effective approach is often multimodal, combining therapy, techniques, and sometimes medication. 1. Behavioral techniques: self-practice or with partner. These are non-medical methods aimed at improving control over time. A. Stop-start technique. Method: during intercourse or masturbation, when you feel about to ejaculate, stop stimulation, wait for the urge to subside, then resume. Goal: helps train the body to recognize and delay climax. Repeat 3 to 4 times before allowing ejaculation. B. Squeeze technique. Method: when nearing orgasm, gently squeeze the penis head glands for several seconds. This decreases arousal and delays ejaculation, works best when practiced consistently. C. Pelvic floor exercises, Kegel exercises. How? Strengthen pelvic muscles, the ones you use to stop urination mid-flow. Do 3 sets of 10 reps daily. Helps with control over ejaculation muscles. D. Mindfulness and deep breathing. Mindfulness helps you stay present and reduce overstimulation. Deep breathing slows your heart rate and delays orgasm. Method: inhale for 4 seconds, hold 7 seconds, exhale 8 seconds. Try the 4-7-8. 2. Psychological counseling and sex therapy. This is useful especially if anxiety, stress, or relationship issues are involved. A. Sex therapy. Trained sex therapists can guide couples through exercises and communication strategies to reduce performance pressure and improve intimacy. B. Cognitive behavioral therapy, CBT. Helps reframe negative thoughts, build sexual confidence, and reduce anxiety, often combined with physical exercises or meds. C. Couples therapy. Helps address tension, lack of communication, or sexual dissatisfaction in the relationship. 3. Medications. These can delay ejaculation, especially in moderate to severe cases. Some are used off-label, not originally designed for PE. A. Antidepressants, SSRIs. Used because one side effect is delayed ejaculation. Side effects: nausea, dizziness, low libido, delayed orgasm, fatigue. 4. Topical anesthetics. Applied to penis 10 to 30 minutes before sex to reduce sensitivity: lidocaine/prilocaine cream or spray, example Promescent. Leave on 10 to 15 minutes, then wipe off before intercourse. Pros: fast-acting. Cons: may numb partner if not wiped off properly. 5. Painkillers, example Tramadol. Off-label use, taken 1 or 2 hours before sex, has a delaying effect but risk of dependency. 6. PDE5 inhibitors, example Viagra, Cialis. Mainly used for erectile dysfunction, may help with confidence and allow a second round of sex combined with SSRIs in some cases. 7. Natural and lifestyle remedies. Exercise, regular cardio, and strength training improves circulation, testosterone, and mental health. Avoid alcohol, smoking, and recreational drugs. These interfere with arousal and sexual stamina. Healthy diet boosts energy and hormone balance. Focus on zinc-rich and antioxidant foods. 8. Supplements. Some studies suggest benefits from zinc: improves testosterone and prostate health. L-arginine boosts blood flow. Ashwagandha reduces stress and improves stamina. Korean ginseng or maca root. Note: always consult a doctor before using supplements or herbal treatments. Top foods that help control premature ejaculation. 1. Bananas. Rich in potassium and B vitamins, increases energy, boosts testosterone and improves nervous system function. Contains an enzyme called bromelain that may improve libido. 2. Oats, oatmeal. Contains L-arginine, which boosts nitric oxide for better erections and stabilizes testosterone levels, good for morning energy and hormone balance. 3. Spinach and leafy greens. High in magnesium, helps dilate blood vessels and increase blood flow and boosts testosterone levels. Rich in folate for better stamina. 4. Dark chocolate, in moderation. Contains phenylethylamine and serotonin boosters, improves mood and reduces performance anxiety. Flavonoids support blood circulation. 5. Garlic and onions. Natural blood thinner and improves circulation. Increases nitric oxide levels for stronger erections and control. Contains allicin, which reduces cortisol, stress hormone. 6. Nuts, especially walnuts, almonds, pistachios. Rich in zinc, L-arginine, and healthy fats. Zinc increases testosterone and improves sperm quality. L-arginine boosts nitric oxide and helps last longer. 7. Pumpkin seeds. Packed with zinc, magnesium, omega-3s, great for hormonal health, prostate function, and stamina. 8. Watermelon. Contains citrulline, converts to arginine, increases blood flow, sometimes called natural Viagra. Hydrating and refreshing. 9. Eggs. Loaded with protein. 6. B5, support hormone regulation, helps reduce stress and improve libido, provides energy and testosterone support. 10. Avocados. Rich in vitamin E, potassium, and healthy fats, boosts sex drive and heart health, improves nerve health for better control. Bonus foods and drinks. 1. Green tea. Antioxidants, catechins, improve blood flow and libido. 2. Ginger tea, anti-inflammatory, warms the body, boosts blood circulation. 3. Greek yogurt, high in protein and B vitamins. 4. Pomegranates, increase testosterone and improve stamina. Foods to avoid, they can make premature ejaculation PE worse. 1. Alcohol numbs sensation and kills stamina. 2. Fried and processed foods lower testosterone, clog blood vessels. 3. Sugary foods and soda, hormone disruptors. 4. Too much caffeine may trigger anxiety and PE. 5. Spicy food, in excess, can irritate prostate in sensitive men. Diet for a bigger, stronger, healthier penis. Boost blood flow, stronger, fuller erections. Good erections equals good blood flow. These foods are natural vasodilators, they relax blood vessels. Foods. Beets, high in nitrates, nitric oxide, better blood flow. Watermelon, contains citrulline, improves blood flow. Spinach and kale, rich in nitrates and magnesium. Garlic and onions, natural blood thinners. Pomegranate juice, increases testosterone and nitric oxide. If you're looking for foods that may help improve stamina and sexual performance, like lasting longer in bed, you're not alone. Diet can definitely play a role in boosting energy, circulation, and hormone levels. Here are 10 foods that are often linked to better endurance and performance in the bedroom. 1. Bananas, rich in potassium. Bananas help regulate blood pressure and improve circulation, which is important for sexual stamina. 2. Nuts, especially walnuts and almonds, packed with healthy fats and amino acids like L-arginine, which can help increase nitric oxide levels and improve blood flow. 3. Eggs, high in protein and B vitamins, which help regulate hormones and reduce stress, both crucial for lasting longer. 4. Avocados, full of healthy fats and vitamin B6, which support heart health and energy levels. 5. Fatty fish, salmon, mackerel, loaded with omega-3 fatty acids, which boost blood flow and testosterone production. 6. Dark chocolate, contains flavonoids that enhance blood circulation and reduce stress levels. 7. Berries, strawberries, blueberries, high in antioxidants and flavonoids, which support cardiovascular health and stamina. 8. Watermelon contains citrulline, a compound that may help relax blood vessels and improve blood flow similar to how Viagra works. 9. Garlic, known to improve blood circulation and help prevent buildup in arteries. This is key for strong and lasting performance. 10. Chili peppers. Spicy foods like peppers can boost metabolism and increase endorphin levels, which may enhance stamina and mood. Thanks for watching. For more informative videos, please visit our channel. Please like, share, and subscribe.